Premenstrual syndrome, or PMS, affects approximately 1 in 3 women. It's a set of symptoms that tend to come in the week before a period, and they're linked to the levels of both estrogen and progesterone rapidly declining. So it's incorrect actually to say that somebody's hormonal at this time, as actually the opposite is true, and the symptoms are caused by these hormone levels dropping. Once the period comes, the symptoms tend to resolve within a day or two, and symptoms can vary a lot from person to person. They can be physical or psychological. Pause here if you want to read this full list of examples. Alongside emotional symptoms, you may have a change in your sleep pattern, in sexual desire, or in appetite, which can also affect your general mental health, and relationships can also become strained because of these symptoms. It's normal to feel different throughout the month because our hormones fluctuate throughout our cycle, meaning we feel different at different times. Our pain threshold, mood, dietary preferences, sleep, and even the way we walk changes too. For decades, women have thought of their menstrual cycles as something they have to endure, but we're seeing a change in attitudes, that these natural fluctuations in our hormones can actually be used to our advantage. By understanding the science of ourselves, we can adapt our schedule to harness the superpowers of our hormones. The best way to start is by cycle mapping. This means using a diary or an app to figure out how you feel and perform at different stages of your cycle. There are 4 different phases of the menstrual cycle, and our hormones fluctuate throughout. Estrogen and progesterone tend to have different effects on how they make us feel. If you want to know a little bit more about how you might be able to hack those hormones, let's take a look at those 4 phases and see what trends there are. But remember, you're an individual and this may not apply to you perfectly. Mapping your own cycle is the best way to get the best out of your hormones. Phase 1 is the period phase. It starts on the first day of your period and lasts usually from around days 1 to day 8. Phase 2 is the follicular phase, and this is usually from around days 8 to day 14. Phase 3 is the luteal phase, and this is usually from around days 15 to day 21. And phase 4 is the premenstrual phase, usually from around days 22 to 28, the week before your period.